Despite ongoing efforts by the county and health systems to roll out the new COVID-19 vaccine, studies show communities of color find it difficult to trust the system. As ABC 10 News reporter Rena Nakano explains, that mistrust has deep roots.
The mistrust is real.
Roberto Alcantar with the Chicano Federation says tackling a mindset may be harder than tackling the virus.
Historically, we've seen that in the Black and brown communities, there's been a general mistrust of government.
New data from the Pew Research Center shows only 42% of Black Americans say they would get a COVID-19 vaccine once it is available, compared to the 61% of white, 63% of Hispanic, and 83% of Asians. Not because they're anti-vaxxers. Instead, many attribute that to the Tuskegee syphilis study.
Horrific stories that we've heard about, medical trials in the Black community back in the 1950s and 1960s in which, there were things being done without their awareness.
It was a 40-year experiment that affected more than 600 Black men who were told by the American government they were getting treatment for syphilis and other illnesses, when in reality, even after treatment was found, they continued to get unrelated injections.
There's a lot of justification for that mistrust.
Locally, Latinos by far make up the most positive COVID numbers, but Alcantar says the level of confidence in a new vaccine is still low. Whether it's lack of access, information, or trust, Latinos have historically sought out less care, and the pandemic has only highlighted medical inequities.
This pandemic has hit communities of color in a very disproportionate manner.
That's why he believes it's important for community organizations to work with the government, not to force on the vaccine or sway people's opinions, but to build trust.
There's a lot of work to do in regards to trust with government, but we're here to make sure that our communities are well informed, have all the facts, and they can make the best decision for themselves.
Rena Nakano, ABC 10 News.
The World Health Organization attributes vaccine hesitancy as one of the 10 greatest threats to global health.